Measures are being rolled out to help children in this digital age develop healthier habits by spending less time on their mobile devices and instead getting more sleep and exercise and eating healthier food. There'll be guidelines on screen times for parents and schools with recommendations for infants to have zero time on devices. There will also be personalised health plans for primary 1 to 3 students. For now, Grow Well SG will focus on those up to 12 years old. It will be extended to older age groups later.
In recent years, population health has been a very key focus of MOH health policies. We launched 2 major national initiatives. One was Healthier SG, the other one was Age Well SG. There is now very good evidence, both internationally and locally, that shows that for a child, their first 1,000 days of their life is actually very important. And this is the time when a child inculcates good life habits, and it has actually profound impact on them even as they grow up.
Let's take a closer look at some of that evidence the Health Minister mentioned. First, excessive screen time. Local studies have found that children aged 1 to 3 average about 2 hours daily. The recommendation is just 1 hour per day. Excessive screen time has been found to be associated with poorer language skills and shorter attention spans in infants and toddlers. Next, inadequate rest. Children are sleeping less than the recommended 9 to 10 hours daily. For infants, not getting enough sleep is linked to stunted growth and a higher body mass index. Studies also show that around half of 8-year-olds are not meeting the recommended daily active play of at least 2 hours. 44% of 5-year-olds also have unhealthy eating habits, consuming high amounts of saturated fat and refined carbs. The proportion of school-going children under 18 years old who are overweight has also gone up since 2013.
We need more decisive and more effective measures to shape the habit of device usage for our young. Device usage do take away time from our children in terms of physical activity, in terms of bonding with their loved ones as well as their friends, in terms of social interactions. And also excessive and improper usage can also shape their social, emotional well-being.
When it comes to screen use for students and preschoolers, at least one preschool is ahead of the game and already limiting screen time for children in its care. Alif Amsyar reports.
For these young, curious minds, everything new they see and touch is a grand discovery.
We have a policy of no screen time for children 3 years and below, because we believe that hands-on experiences will be the best way for children to learn, especially for very young children, because their brain development is very crucial at this age, and hands-on experiences actually stimulate the development.
For the slightly older friends, digital tools are used, but only meaningfully, like when learning about complex topics. It's an example of how screen time should only be used to help the young learn when a new mandate for preschools kick in next month. Preschools will first get help and guidance in the first 6 months. After that, the Early Childhood Development Agency, or ECDA, could step in if lapses are found.
ECDA will direct them to cease such practices and may take further regulatory actions if children's well-being is compromised. The incorporation of explicit guidelines on screen time will remind educators of the role of screen time in early childhood care and education. It is to support teaching and learning, and not to be used as time fillers to occupy children's time and attention.
More importantly, authorities say cultivating good habits start at home. The Health Ministry recommends that outside of school, children between 3 and 6 years old should spend less than an hour on the devices a day. For older ones between 7 and 12, they should ideally not use the devices more than 2 hours unless it's for homework.
Plus, the Education Ministry has also given more detailed guidelines to primary and secondary schools on managing their students' use of smartwatches and smartphones. Now, this includes the use of mobile devices only in designated areas and at appropriate times, such as during recess or after school.
Schools can also set up dedicated storage spaces for students to deposit their phones before the start of class time.
Now, for more on Singapore's moves to limit children's time on devices, I'm now joined by Assistant Professor Evelyn Law from Khoo Teck Puat, National University Children's Medical Institute. Professor Law, welcome to the program.
Thanks for having me.
So for a start, explain to us why the need to avoid screen time entirely for infants less than 18 months old.
Yeah, so for 18-month-old, they're rather young. So they're still starting to walk and learn language. And so at that time, when you have a lot of screen time, it's really replacing all types of learning and interaction. And what we have found in Singapore with our research studies is that these children, when they grow up, it seems that the area of the brain that controls focus and attention, they seem to be less mature. And we have found that in the Gusto study. And so therefore, it's a big warning to all of us that when children are really young, there really shouldn't be any screen time.
And among the updated recommendations for children up to 12 years old is not to give them unrestricted access to mobile devices or social media. Explain to us why this is necessary.
Yeah, so when children have excessive screen use or unrestricted screen use, many of them actually end up doing gaming or going on social media. And what we've found in our studies in Singapore is that around 11% of children already are reporting gaming addiction. And many of them are using social media that's not even appropriate for their age. Many of the social media we know of actually is appropriate for 13 years and above, and much younger children are already using them.
And could you then suggest ways for parents to help wean their children off screens?
Certainly, I think starting early definitely is one way. We know that if we had a long-standing habit, it's already really difficult to change. Perhaps one way that helps parents quite a bit is to look at screens if a child's really having excessive screen and it's getting really unhealthy. In the same way that you wouldn't put out unlimited snacks for your child or unlimited sweets, think of it that way and say, wow, okay, I better do something about it. And so limiting can sound difficult, but if you know that it is interfering with the child's learning, certainly it gives you enough reason to do that. Another thing I think is just to stay really consistent. If you're not sure, a child will always test your limits. And you then it's really hard to then set those limits.
Limiting is difficult for some parents, as you said, and different families may have different ways of raising their children. And some parents may, not have enough support at home. And so they rely on using screen time to keep their children occupied. So how can we help support these parents better?
Yeah, it's definitely very difficult. I think when parents have many things to do, many errands, a lot of times they see the screen as engaging with the child. But I guess another way to just look at it is we enforce brushing teeth every day. We enforce different things, sleeping at a certain time. So we do have to think of screens as not just babysitters, but really having good and sometimes bad also. And I think that sometimes can, help parents. And at the same time, this is not a guilt trip for parents at all. It just needs to be balanced really well. If you're spending a lot of time with your child playing that day, screen is also okay. And, especially if you join in sometimes, it's entertaining, it's fun. So here.
So what is considered good screen time and what's considered bad screen time?
Yeah, certainly. Good screen time we see, in the past, when we watch Sesame Street or when we sit down with the family and we watch a movie together, those are all beneficial because the parent is there and the child's not hiding anything or going really excessive hours. And we know that screens can provide quite a bit of education. There are shows that help with, ABCs and math. So they're not all bad. I think it comes down to whether the content is appropriate, whether there's a lot of violence, or content that's just not suitable for children. So really it's the context as well as the content also.
And these are so far recommendations by the ministry. They're not laws just yet. How effective will they be in getting parents, carers and educators to comply with these guidelines?
Yeah, I know there are lots of guidelines and recommendations out there, just like for pregnant women. We have recommendations to eat healthy, go see a doctor, and don't drink alcohol. All of these, they're not laws, but I think what this creates is a local guidance and letting families know to have this awareness and education that we have science to show some of the effect or negative effect of excessive screen use. So it becomes a conversation, and I think schools will be discussing that, the school staff with families and clinics and hospital, as well as in the community. So I think it's a whole population approach.
We're definitely taking a step in the right direction here, right, Professor Law? But thank you so much for coming in to speak with us. Appreciate your perspectives. That was Assistant Professor Evelyn Law from the Khoo Teck Puat National University Children's Medical Institute. Thank you.